Welcome to What Would Sabrina Say? I'm Sabrina Dong, and I'm excited you're joining me today. In this podcast, I dive into mental health topics on relationships and overall well-being. With over 20 years of experience as a licensed clinical social worker, I share insights and invite expert guests who are passionate about making a positive difference. I started this podcast because I was frustrated with the often misleading or recycled information in social media involving self-help and the mental health field. My goal is to provide you with genuine, useful content that's educational and informative. Thanks for tuning in. I hope you find our conversations both enlightening and empowering. I'm glad you're here. Thank you, Dr. Laura Tanzini, for joining me today. I'm so happy to have you here to talk about the nature of forgiveness. I think that's especially important during this time of year for many people as we go into a time of the holidays and the complex dynamics of families. So appreciate you being here. And if you can kindly share about yourself and about Kinder in the Keys.
Kinder in the Keys, I'll start there, is a mental health treatment center for women only, and we specialize in trauma-related disorders. So anything that would include post-traumatic stress syndrome or anxiety, depression, and trauma could be anything that would cause a loss. So it could include violations, but it could also include death or, the loss of a pet. So for me, I am a licensed therapist, marriage and family therapist in both California and Florida. And I have a doctorate degree in public health with a specialty in lifestyle medicine. And on my dissertation and publications, I specialized and did the writing on forgiveness and trauma.
And that's such a really important piece, I think, for many people who have experienced trauma around loss and forgiveness and how to move past that when you are not able to. So thanks so much for joining us and to be able to talk about it. Again, such an important topic. I'm wondering if you can share and talk about what forgiveness is. I think sometimes even the definition might be different for people. So that might be helpful to start there.
Well, that's a good question. And interestingly enough, when I went into writing and my research, I really didn't understand the complexity of forgiveness. That forgiveness, even in the literature, is really obscure. But what I found out was that there's 3 different types of forgiveness. And there's forgiveness of self, there's forgiveness of others, and there's forgiveness by God. So forgiveness becomes a very religious-oriented type of concept, and it goes off into a lot of ways. So I think when we're talking about forgiveness, we have to kind of include what we're talking about. Forgiveness of others. As a woman in my treatment center, if they've been raped or molested, is forgiveness of others an important thing in the area of healing? And also, did we do something to provoke that, and do we need to forgive ourselves?
Right. I think that's an important part of forgiveness as well, too, is about ourselves and the self and how that might be difficult, too. Many people rehash the past, get mad at ourselves for maybe in hindsight things that could have been different or should have. So it's not only hard to potentially let go of what others have done, but maybe our own choices and decisions sometimes too, and forgiving ourselves for that.
Yeah, it was a complex dissertation to do, needless to say. But you're right, forgiveness of others tends to be a little bit easier to do than forgiveness of ourselves.
Just wondering, how would someone notice they're having difficulty forgiving? What would that look like? What would that experience be like?
As a therapist, there's a couple of things. When a person would come in and they were violated in some way, and they would say to me, well, I've already forgiven that person. I said, okay, well, that's fine, but have you done the work in yourself to heal yourself? And I found that as a therapist that it was very, very difficult to get to the healing part and doing the work if they've already done forgiveness work. They have to, it's like putting the cart before the horse. They have to do the healing work. They have to go into the work that's required to resolve their own pain. And if they choose to go into forgiveness of others, then they can do that at the end of that process. So as I learned, we got to the end of that process with many people, and forgiveness became not as important.
Right. So it can be separate from that healing process.
Yes, it can be
or should
separate
be.
from that completely. And I don't, from what I found in the research, you don't really need to do a forgiveness piece of healing to be healed from like a trauma, a molestation or a rape.
Right. I think that that does seem to be part of the understanding with expectations of therapy and healing from trauma, that there needs to be closure. There needs to be this certain outcome with expectations in order to heal. Or people say, how do I know that I've reached that end of the journey? Am I different somehow? Is that experience different? Does the hurt or pain go away? And I think it's important to know that you don't necessarily need to do the journey so specific or look like someone else's that you might see out there,
Mhm.
who may have had the opportunity to forgive or to have conversations with someone. That does not necessarily need to be part of that healing process or journey.
It doesn't need to be, but this is where you bring in the religious factor and forgiveness, because I think that if somebody is religious or they are spiritual, for them, healing includes forgiveness. So they bring that in as a complete healing for them because it's a very spiritual basis for them. And that forgiveness, if a person is a religious person, the forgiving nature is more important to them than if they're not religious. And so I think that there was those pieces involved with there. Now, people who were religious and had done a lot of forgiving, their healings tended to be a little bit different, but that was the variable, and that was the religious component.
So the process and where to start may look differently for people, depending on different variables or values. Faith, if faith is important for the person, but what's most important is to have that healing work start and completed. Like you said, if you're already, forgiving a person, there's a process or steps before that need to happen, and exploring how you experienced the situation and what it felt like and meant for you versus focusing always on maybe another person.
Yeah, definitely. You got to do that personal work before you can get to that end piece. And so forgiveness, in terms of doing therapy, does get in the way, in the beginning part of that. Now, people want to go and, they do the forgiveness piece, or it's always a good thing. I think it is. But in terms of life satisfaction and being happier in your life, didn't play a big role in there.
That's really interesting to know. Is there anything else from your research that you'd like to share in terms of the outcome?
Well, there was another conflict that I found that I think us as therapists are taught that, the younger the wounding, the harder it is to get through that. But the research doesn't support that. It supported, or at least my research didn't, it support the younger they were, they had an effect, obviously. But when they were teenagers, if there was a molestation or rape in teenage years, it was much, much more difficult for them to have a higher life satisfaction score at all. And then if they had multiple traumas, a repetitive thing, then it was harder too. Those things were interesting to me because I was always told that the younger they are, the harder it is. But the research didn't support that at all. So I found that was a pretty interesting outcome that I had in the research. The forgiveness of self, was always very, very hard to do. I think that there's a shame component involved with that. And when there's shame involved, it becomes a defect in a person, and that's how they interpret that. And it's much more difficult to forgive yourself because of that shame correlation, I think. Forgiveness of other people tended to be a little bit easier. They were able to do that a little bit more. So those were some findings that I had.
Is there anything around using sort of a holistic approach in intervention when it helps with healing around forgiveness or around trauma?
A holistic approach to treatment of trauma?
Of trauma or even forgiveness. Like, for example, if somebody's faith was important, finding a counselor perhaps that would support that or be open to that versus maybe not, or just using more of an open approach, or was any
Well, in terms of the treatment of trauma, I take a very eclectic approach to doing therapy. I find that trauma tends to be a bit elusive. So you can deal with it with a particular type of therapy today, but tomorrow it won't the same effect. So we do a lot of holistic work at Kinder, and, we'll do quiet body movement. It may include music where they're just moving their body to that, or it could, a lot of journaling, a lot of art, yoga, just therapeutic outings like getting into nature, moving your body, and obviously process work that would include all different kinds of therapeutic modalities. And then, EMDR is part of it, cognitive behavioral therapy, of course, a lot of the psychodynamic, we use a lot of the different types of therapy. Forgiveness work it isn't something that we actively work on at Kinder in the beginning stages because it gets in the way. So people, they can go out and do their own forgiveness work. I don't think that if they had a spiritual helper, a priest or a pastor or even a therapist, that if they're secular, that they could move them into a good peace with forgiveness. I don't have anything that's in my head about a holistic approach to doing forgiveness work, but definitely therapy.
Okay. And I think it's helpful for people to know that you might need support in a different way, or it looks different within the process, and where you're at with healing, and even with that process of forgiveness. If you're not yet ready, it doesn't hinder you from moving forward in your life or achieving things you want to.
No, I don't think that it does. I think that people can be very healed in a lot of ways and still be healthy, functioning people in the world without moving into a complete forgiveness piece of work. If they're willing and wanting to do it, then it's out there and available. But I don't think that they are going to hurt themselves by not moving into the forgiveness piece. I didn't get, even as an active therapist and as a researcher, that there was anything that was true in that. I think that people become more content in life when they can move into forgiveness, because I think that they feel resolved like within themselves. I don't think that in terms of healing from a trauma that you have to move into.
I'm seeing so much talks from Dr. Gabor Mate and even psychiatrist Frank Anderson around healing doesn't come from the other person. It comes from finding peace within yourself. Was there anything around the research of like, yes, it's most important to have that peace with yourself and forgive yourself versus, let's say, others?
Well, that's the part about the religious component and the life satisfaction. So if you bring in religion and forgiveness, people's life satisfaction improved. And so there is that component in there. And that's what I said, it's more satisfying. Not that people didn't have a high regard for their life or life satisfaction. It just became, they felt, God can forgive, so I need to forgive. So it became this thing that they needed to do for themselves to feel to feel the life satisfaction go up, to feel more settled in that. But I think that you can have that separate than a trauma. A trauma can be a lot of different things, and a trauma could be a hurricane that devastated your house, or it could be, a rape. So it doesn't have to be something that somebody else did to you or that you did to yourself. So when you're talking trauma, that's the difference.
And with trauma, it's more, processing feelings around anger, resentment. You could still do that without forgiving.
Yes, absolutely. Yeah, you process through anger, you process through whatever grief, sadness, guilt, all of those things.
And just wondering, for people who may wish to know the difference between forgiveness and reconciling with others, and if there was anything in the research there as well too.
I don't think that those are the same thing. I think that forgiveness is a very internal process. No matter what kind of forgiveness it is, it has nothing to do with somebody else. You don't have to go speak to anybody and say for you to feel satisfied with that piece of work. Reconciling is something completely different. You have to reconcile differences. So maybe you have a huge difference with somebody, you go up and talk to them to try to see if you can come together in that. But forgiveness has nothing to do with that. I don't think that you have to go and reconcile with somebody in order to feel full with forgiveness of somebody else doing something to you. It has nothing to do with another person.
Sometimes people attach forgiveness with that closure with needing the validation, acknowledgement that trauma has happened or loss, or needing some sort of witness or affirmation. And sometimes I think forgiveness in that process is connected to those things. So with your experience, can someone get acknowledgement, affirmation, validation through other ways like therapy without having to involve people, that event, others for healing or forgiving?
So to me, I would approach the person and say to them, what's your expectation of that? Having that conversation with somebody who's hurt you. What's your expectation? That they acknowledge, that they say they're sorry, that they cry with you, that what you have to be clear about what your expectation is in that situation, because realistically, you may never get what you expect. I think that that would be something completely different if somebody had to go and confront somebody in order to move into a healing place. I don't know that that's necessary at all. I think it may be necessary for some people to do in some situations, but that's where I would come from. What's your expectation about the outcome? Because if you're not clear about what your expectations are, it could be very likely you would be set up to not get what you want. But I don't know that that has anything to do with forgiveness. I think that that's completely a separate issue. I think it's more of a therapeutic issue, an actual forgiveness piece of work.
Right, because that could also be re-traumatizing too, and so exploring the purpose or need for that.
Yeah.
And closure that way.
But that's a really, really good question because I think that people do get that misunderstood.
Yes, and I think that's where therapy can help, is to share knowledge about the trauma, what healing can look like, what's helpful, what might not be helpful or cause, again, recreation of flooding or disappoint. Again, like you said, what would be the purpose or reason? If it's to hurt the other person the same way, it's processing that. If it's to hear something that you may not hear, like an apology, etc., and exploring then what, right? And how to help through that.
Correct. Yeah.
Just wondering, there's anything else you'd like to add around forgiveness that we haven't touched upon, or anything from your research?
I just think it's a very complex thing and, just in the world. And I think that as a therapist, I think in the beginning, I would go in and tell people that, forgiveness happens at the end of the process, but you need to go into forgiveness in order to feel really content and happy. But I really did find out later, and especially throughout my career, that really wasn't the case. I don't think there's anything wrong with doing forgiveness work. I think that there's a level of peace that comes over people, especially if they have a religious component to them or they are religious. I think it's important in that way. But also, I think that if forgiveness of self is so difficult, there has to be a lot of shame work with that. So I think that those are things that if you're having a really hard time forgiving yourself for something, then doing some shame work, which is hard. It's hard to do. I think those are big things that come around with forgiveness. But certainly you got to get through all the anger and all that first.
And was there anything that you noticed in around forgiving people whom they have passed, like deceased loved ones? Again, conversations you're not able to have, or things you're not able to share or say. Anything around that at all that might be hard for people?
Well, I think again that comes to, if they were alive, that they would have a conversation with them with the expectations. Forgiveness is very much an internal construct. It isn't about somebody else. You never have to say, I forgive you. You never have to say that. So again, if your spiritual people will know that there's trust that person can still hear them if they want to talk to them. I think that people who are not spiritual may not believe that way. So I don't know. I think there are people that are angry with people who have died, but I think that comes with grief work too. You have to do a lot of grief work with that.
Yes, and that's definitely can be part of grief. I think sometimes when we think of losing loved ones, it's all about, well, you have to respect the person who died, you have to think positives, but there's all these mixed emotions and feelings that are okay to have in that process. And if there might be some internal work around forgiveness, that might be part of that journey as well.
Could be. They could be just angry they died. And you have to do some anger work on that, and move into whatever you can in your own grief work and process, which can take a very long time.
Well, thank you so much, Dr. Laura, for coming on and sharing about your research and work. And I was wondering if anyone would like to connect with you, or learn more information about Kinder in the Keys, if you'd like to share where they can go for more information or resources.
Yeah, kinderinthekeys.com. really easy. We have a lot of information on the website. The phone number's right there. You would probably talk to our intake department if you had main questions. But if you have any questions specifically about that, the intake department can help you. We have 2 houses, really nicely done in the Keys, really beautiful, nice houses. So it's a good place.
Yes. It seems to be such a great program and an environment that supports women in any way they can, and that sense of community that I had seen. Got a sense from your site and talking to your staff, which is really great. I think that's really part of the healing process, and that's helpful too.
Thank you. I'm glad that you were able to talk to them. Yeah, I think it's a good place for healing. We're the only women's facility in the United States that deals with strictly trauma. We don't do any substance abuse. We're not a rehab. I think people kind of, correlate it to being a rehab, but it's not. So we don't take active addiction. So it's a really good place to go to just work out. If you feel stuck, or you're having a lot of symptoms from depression, anxiety, PTSD type symptoms, it's a great place to just go and dig deep into what's going on so that you can move on and live in a really healthy, productive life. I teach all about empowerment. So it's about empowering your life. And when we have a trauma and we're all filled with PTSD symptoms and anxiety, you're not living empowered at all. You're living in the pain of all of that. And so it's nice to be able to go and just take a break and from life, but delve into yourself. It's not really a break. It's a lot of work, but it's good work. And the average stay is about, I don't know, 4 to 8 weeks, average about 6 weeks at different, couple different levels of care. And the women that leave usually we keep up with them. Like we have a follow-up care, afterward care. And so we know they're doing well afterwards.
That's really great that you have sort of aftercare and follow-up services, because not every treatment center or service offers that. And it's really important to help people you're empowering to integrate the tools into everyday life. So that's really important when people are looking for supports and healing, that there's such a service and program.
Yeah, so it's hard to find the program that's not a dual diagnosis program. And I think that that's the difference of what we offer. We don't offer the addiction treatment. The other programs are dual diagnosis. They're fine. They do trauma work, but they also do the addiction work at the same time.
Right. And I've come to learn that not many places who offer recovery are working around trauma, and how that's so important. And it's great that there's such a specific retreat center and service that helps to work around trauma. Is it all types? Would it be also childhood trauma, current trauma, complex?
Complex PTSD, absolutely. But we've had everybody come in, all the women that have come in have had a wide range of what the trauma is. We've had a few people that have had medical issues that have caused them a lot of trauma. If they're looking at their life got affected, in some way, that, they had an amputation from a cancer or something, or, real PTSD, war-like PTSD. That's huge. Losses, a lot of losses, absolutely a lot of violations in a lot of different ways. Somebody committing suicide in your family. We've had, unfortunately, that come in. So it's a wide range. We had somebody who had such severe impacts from Hurricane Irma that they came into treatment. So it's just all over the board with trauma, what is affecting the person inside.
And then when it comes to recovery from medical and cancer survivorship or other illnesses, I notice there's lots of support maybe before the treatments or during, but there isn't so much what to do after. If there's healing work, or again, going through trauma around medical treatment. And so that's great to know that your services offer that support.
Yeah, I think it's good. Their life does change, but it can still be full.
Definitely. Thanks so much again for your time, and happy to have you join for any other topics. I learned so much today about forgiveness, and great to hear about the research, because myself as well thought the earlier trauma has happened, it's impacted earlier on and with the developing brain. And so it's great to know that healing can happen through any stage and milestone, and same with forgiveness. So thank you so much.
You're welcome. Well, thank you for having me on. I enjoyed it.